Hey, it's Weed. We're going to talk about the hip hinge personal assessment or self-assessment, how to determine where you should be deadlifting from. Remember, safety is the most important factor, so if you have some sort of physical limitation, please email your professor and let's not injure yourself anymore, because once you ring the bell of back injury, it's tough to unring them. So what we're going to be doing, so far we've talked about cues: chest out, shoulders back, pits to hips. So that's what we want to look for when we're doing this for the upper body. The lower body cues are going to be, number one, you need to determine what your setup is. And it is your setup, whether you want to have a very wide setup, almost like a sumo setup, or you want to go shoulder width apart. So if you stand tall and put your hands down and where your fingers would point through the middle of your foot, that's approximately what is expected. Some people like a narrow setup. So you have to figure out what your setup is, but whatever it is, take ownership of it. So the lower body cues, I like about a shoulder width apart. So my cues are going to be heels together, and I don't know if you can see that in the video, so I'm going to rotate my heels together, and what happens to my knees? So heels together, knees out, and when you do that, you're squeezing your butt cheeks. So if you stand tall here, you should be able to pinch your cheeks together. And that is a good cue, knowing that you're the whole way through. So that's good, maintains good lower back activation. So I have two different dowels here, so it doesn't matter what you use. This is a dowel for the FMS, and this is a mop handle that I took the mop off. So all you need is some sort of straight pole to do that. The 3 points of contact when you get this are going to be your skull, your T-spine, which is between your scapula, and your butt crack or your sacrum. So I'm going to be in this position right here. I'm going to have my setup: chest out, shoulders back, pits to hips. I'm going to go this way so you can see better instead of seeing my elbow. I'm going to have my heels together, knees out, and what I'm going to do, I'm going to have soft knees, so a slight bend in my knees, and I'm going to rotate as far forward as I can, maintaining that posture. So if I get to this position and I drop down, that is fairly close to where I could pull the bar from the ground if I want to. That does not mean that I have to.
Do that again?
I'm going to do that again with the other one.
And I'm just going to point out, hi, I'm Professor McQuaid.
So whatever you want to do, 3 points of contact again are your skull, your T-spine between your scapula, and your sacrum or butt crack. Soft knees. Some of you are going to struggle with that. You're going to try to lock your knees out and bend. This is not a flexibility test. This is the hip hinge. So my hips are going to be going backwards as I go through as far as I can, maintaining contact. And notice I'm keeping neutral spine as I do that. Some of you are going to do this. Look what happens. I lose T-spine. If I do this, I lost my skull contact. So I want to be here and maintain contact. Some of you are going to do this. And that is going to be your hinge. That is not a hinge. That is you rotating your upper back. So to warm up and practice this, if you want to, you can stand tall, soft knees, put your hands on your hips, and slide down as far as you can go. And depending on a number of factors, some of you are going to be better hingers than others. And that's okay. Some of you are better squatters than hingers, but that's a self-assessment, and we're going to be talking about the deadlift, so check out the deadlift video. Thanks. Be safe, move well, move often.